Did you hit the red circle? Okay, hey guys, I wanted to walk over just a really, really useful progression that we covered here at the MPI Sports Symposium, the rep gathering. It's one that I've been using a ton, and the purpose of the exercise is to really get the patient, or the athlete in this case, to be able to stabilize their spine in a way that they do not overuse their spinal erectors. Now, the caveat there is, in order to do that, you need to first teach them how to pressurize properly into their abdomen. And the thing that we have to get them to feel is the pressure in the belly, not just pushing forward, into the abdomen or even down into the pelvis, but we need it physically pushing back against the spine. When it pushes back against the spine, that gives the spine stability from the inside or from the front, and that enables the brain to relax the spinal extensors that have been super tight in response to sort of any back pain or instability or whatever. So we're going to walk you through basically a big progression. You doing okay, Madison, over there? Good job. Thanks to Madison behind the camera there. So we're going to walk you through a progression that I use all the way from the most basic up to sort of the most advanced. And this is just teaching the patient how to flex their spine properly. So with pressure in the belly, the spine then flexes over that pressure, and you want to feel the spinal erectors allow the flexion to happen. So we got Chase here. Let's start off. We'll go knees on the elbows. You can face forward there, buddy. No, other way. Don't mess it up, man. So he's going to have his thighs about parallel to the ground. He's going to have his forehead sitting in his palm. So he's just resting his head there. The reason for that is when he starts to practice breathing into his back, that I'll show you here in a second, he should not feel his head lift off of his hands even a tiny bit, okay? If he does feel his head lift off his hands, that means he's using his erector spinae on the breath in, which is a sign of pathological breathing, and it means that he is not stabilized in the way that we need to. Because remember, respiration and stabilization can kind of go together. So the first exercise, you're going to be just kind of behind them like this, and you're going to have them practice breathing down against their pelvis and out in all directions, the main direction being into the back. So for this one, let's have you go ahead and spin over the other side here. So if we watch here, I'm usually sitting right behind them, my hands like this so that they can feel breathing into the back. So for him, as always, we're going to have them breathe into the nose. That encourages diaphragm activation, will make this a whole lot easier. But I want him to basically take a breath in. So go ahead, take a breath in. And I want him to feel the pressure pushing the spinal extensors out this way, stabilizing the spine from the front. So go ahead and let it go. You can have your thumbs kind of dig in here, so come on in a little tighter, Madison. So we got the thumbs just like this. I can sort of push in just like this. Go ahead, buddy, and breathe into my thumbs, and you can see the expansion right there. Go ahead, let it go. Take a breath in again. Breathe into the thumbs just like this. Really good. So if I sort of show you here, if I get in just like this, let it go. If I dig in, breathe into my thumbs. So breathe in, push, 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 push. And we can see that pressure, stay there, is physically pushing back. So we no longer see this erector spinae divot right here. We're seeing that pressure, let it go. So when he relaxed, when you see someone that's stabilizing with that extension, compression, stabilizing strategy, they have this muscle is always contracted and doesn't allow eccentric activation. And that basically keeps a constant compressive load on the spine that can produce stubborn low back pain. So let's go ahead and watch again. So let it go. And now nice and easy, breathe into my finger here, breathe in, push, 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 push. Even more, you got it, keep going. And you can see that expansion there. So what we're trying to do is with this drill first, we're trying to get him to learn how to breathe into the back. So the next one, you can have your hands off your forehead there, buddy. And we're just gonna have him resting on his elbows. And this one, you can send them home just with this, where they're just gonna breathe in. That's another exercise. But then we wanna progress it, and we're gonna progress it in a couple different ways. The first one is he's going to do single arm alternating floor touches, using the pressure in the belly to stabilize his spine as he flexes his spine. Because remember, the cause of a lot of recalcitrant low back pain is the effort to stop low back pain. So it's this great example of irony. So let's go ahead. You're going to take a breath in, feel the pressure filling up the pelvis. Go ahead. Feel it stabilizing your back, and then slide that left elbow off. all the way down, touch the floor, keep the pressure here, come back up, good, reset. Take a breath in again, feel that pressure build, slide, good, come back up, and then go ahead and reset. Now, we can have him go alternate a bunch of times. You must make sure that they can A, feel the pressure pushing against their spine, and B, they can maintain that sensation while they go all the way down into flexion and come all the way back up, okay? The next progression is going to be 2 hands. You got this. So back where he was before. Again, this is 2 hands, so it's going to be more force. They're supporting with their elbows on their thighs to offload the spine to allow them to brace correctly, and then you're going to have them flex their spine, actually flex their spine, bend their spine around the pressure in the belly. Okay, remember, in the absence of intra-abdominal pressure, they're going to turn on their spinal extensors into that extension, compression, stabilizing strategy, which is what produces those pathological forces. Okay, so let's go ahead. So take a breath in here. Feel that expansion. Now go ahead and bend forward, slide forward, feel the pressure supporting here, come back up, maintain that pressure. And I'm digging my thumbs in here so that he can feel that pressure pushing back. If he has the pressure pushing back, it means the diaphragm and the abdominal wall engaged are to redirect that intra-abdominal contents back against the spine to stabilize it. Give me 2 more here, buddy. So breathe in, feel the pressure here, slide forwards, touch, come back up, really good. And I don't want to lose that outward pushing force at any point. I don't want to lose that sensation, and he has to maintain that feeling as well, okay? So let's go ahead and stand you up for the last couple. The last ones are going to be just sort of standing. Now you can start, they're just going to stand like this, so just kind of athletic stance right here. I want them to actually tilt their pelvis back so that they're getting a little bit of a rounded position, and they can just practice breathing right here, okay? That's not really a progression I'm using a ton, but it is one that you can use. It's a standing back breathing. But the one that we really want to do is he's going to be here. He'll take a breath into the back, feel that pressure, bend down and touch the floor, and feel the pressure supporting the lumbar spine from the inside. So let's go ahead, breathe in, feel that pressure, go ahead and bend down. Squat down a little bit, touch the floor, feel the pressure, come back up, and then re-support on the knees. So you want to just like take load off of your, yep, just like that. So breathe in here, feel that pressure, bend forward, squat down, and stop right there. You can see he's rounded over here. This is a position that would normally cause injury, but in this position, we've got good stability in the front, which is allowing his spinal extensors to relax, reteaching proper flexion. Go ahead and come back up. So, thank you, sir. In review, we're trying to use this series of exercises for athletes, Division I athletes, like this guy right here, for just normal everyday people trying to avoid surgeries, because one of the most insidious causes of low back pain is overactivity of the spinal extensors that I call an extension, compression, stabilizing strategy. And those are going to produce a compressive load on the spine, a constant compressive load on the spine that will directly produce symptoms and also blocks normal function. So I guess comment below, but hopefully that helped. This has been incredibly helpful to many of my patients for the last several years, so hopefully you guys benefit from it.